Hello everyone. So my name is Christina. I'm 20 years old and I have something called Ehlers Danlos Syndrome. Now, chances are if you're watching this video, you or someone that you know or someone that you love have been diagnosed with Ehlers Danlos Syndrome, or maybe you're just curious and you stumbled upon this video. Either way, I hope this is helpful to you. I plan on making a whole series of videos about living with Ehlers Danlos, kind of, associated conditions and questions. But today I think we're just going to start with the basics. So what is Ehlers Danlos Syndrome, or EDS? EDS is a group of chronic genetic connective tissue disorders. So it's not something that you can catch. It's not something that you're going to pick up or get later in life. You're born with it, and there's not currently a cure, so it is something that you have to, deal with throughout your life. It's not something that's going to go away. It might get better for a while, and then you might have flares, but it's something that's always there. So now you might be wondering, what causes Ehlers Danlos Syndrome? And that's kind of a tricky question to answer, because there are quite a few types of Ehlers Danlos Syndrome that I can get into later. They affect your body differently, but the thing that they have in common is that they create faulty collagen in your connective tissue. So your connective tissue is much weaker and looser and more fragile than that of a healthy individual. EDS is an inherited genetic condition, so more often than not, it is passed down by one or both of the parents. The parents may have EDS themselves, or they may be a carrier, but it is estimated that if the parent has EDS, it's about a 50-50 chance that the child will be born with EDS as well. It is possible for EDS to come from a spontaneous genetic mutation, but usually has a familial link. So why is collagen so important? Well, collagen is a main proponent in your connective tissue, and your connective tissue is exactly what it sounds like. It's the tissue that keeps your whole body together. And although EDS is commonly considered a joint disorder, you have connective tissue in every organ system in your body. So it's really not uncommon for EDS patients to have a wide variety of symptoms and problems that kind of seem unrelated. Now, Ehlers Danlos Syndrome is something that is still, unfortunately, pretty misunderstood, even in the medical community. So a lot of doctors haven't heard of it, and those who have heard of it maybe read a paragraph on it in med school 20 years ago and haven't seen a patient with it since. And, they look for, extremely hypermobile joints and hyperextendable skin, very stretchy, they think tall and thin and very pale. And I'm not going to say that that's not something that a lot of EDS patients embody, because it is, but they fail to understand kind of the systemic nature of the disorder and how all of these different complaints and these different diagnoses can come together under the umbrella of Ehlers Danlos Syndrome. And unfortunately, this leads to a lot of misdiagnosis. And misdiagnosis has been something that's very harmful to the community, and I think this is something that goes for all invisible illnesses and, chronic illnesses, rare diseases, is that, when all the blood tests come back normal and all of the procedures come back normal, your doctor kind of starts to say, okay, maybe this is anxiety related, maybe this is somatic, maybe this is in their head, and it can even become extreme as, this is a hypochondriac, this is someone who needs to be medicated, this is someone who's doing it to themselves for attention. And that is just really damaging. Not only does it prevent you from getting a correct diagnosis, it's something that stays on your record, and it prevents other doctors from taking you seriously. And oftentimes you lose the support of your support system, your caring system, parents, loved ones, friends. It's just a real shame. And I have to say that probably everyone that I've ever met with Ehlers Danlos Syndrome has been misdiagnosed in the past. And most of them with an anxiety or somatic disorder. Now, earlier I mentioned that Ehlers Danlos Syndrome is considered a rare disease, but more and more we are finding out that it's just something that is rarely diagnosed. Now, 3 years ago when I was diagnosed, I was told that Ehlers Danlos Syndrome might affect up to 1 in every 25,000 people. But then just last year, I heard that the numbers were more like 1 in every 5,000 people. And just recently I've heard speculation that it could be affecting up to 1 in every 100 people in our population. So obviously, within the last 3 years even, the science and research has really come pretty far. Scientists are now working to determine exactly which genes and which mutations are causing this faulty collagen. Right now, there are 6 different types of recognized Ehlers Danlos Syndrome, but I would not be surprised if in the future, even the next few years, there are more scientific breakthroughs recognizing maybe more types or more genes or mutations causing different types. I know a lot of people kind of feel like they don't necessarily fit perfectly into one of the types. My geneticist doesn't quite know where to put me in the types because I did not test positive for some of the specific mutations that are commonly seen with certain types, and that is not that uncommon. Now, I'm really not going to talk about the different types too much today because I'm not a doctor and I don't have a lot of knowledge on that subject. It would make this video really long and it wouldn't be very helpful to anybody. But there are 3 main criteria that kind of span the whole spectrum of EDS, and those are the things that the doctor will be looking out for if you go to get a diagnosis. The first being joint hypermobility. So EDS patients will have more profound joint hypermobility than the normal population. So they're going to be asking you to probably perform some things that we call party tricks. They'll be asking you to do some kind of just little things to demonstrate how flexible you are in certain joints. And then they'll also ask you about your history with joint pain and dislocations. Have you been to the emergency room 10 times to have your shoulder put back in? You know, those are the things that they're going to want to know. 2 is your skin. So they're going to probably test how elastic your skin is. They're looking to see if it's hyperextendable, hyperelastic, whatever you want to call it, or it could be very smooth and velvety, oftentimes, you know, pale or almost translucent, especially in vascular types. And the third being wound healing. So how do you heal when maybe you've had surgery in the past, maybe you've cut yourself? How has your skin and your tissue responded to that injury? So oftentimes they'll ask to see any scars you have. They're really looking for, you know, has it healed well, or has it started to kind of pull apart? Have you had scars open up that maybe, you know, you had surgery 5 years ago and all of a sudden your scar is reopening and stuff like that? And that's really a warning sign. And when you do go for a diagnosis, they will take a family history because family history is important. Like I said, it is a genetic condition. So if you have a family history of strokes or organ rupture, if people have died in your family of heart problems at a young age, you know, those are red flags for connective tissue disorders. And oftentimes they will have you blood tested for other kinds of connective tissue disorders just to rule that out, there are some connective tissue disorders that can look a lot like Ehlers Danlos Syndrome, but carry kind of unknown risks. So you really want to know if you have those conditions. Now, those are the three main diagnostic criteria with EDS, but most patients also will have a whole list of other conditions that are either caused by their Ehlers Danlos or contributed to associated conditions, other symptoms. I can't name them all, but I'm going to read off a few. Dysautonomia, gastroparesis, sleep apnea, Chiari malformation, craniocervical instability, anemia, mast cell activation syndrome, tethered spinal cord, asthma, spina bifida, adrenal insufficiency, mitochondrial disease, anxiety, scoliosis, TMJD, heart valve issues, chronic regional pain syndrome, migraines, seizures or movement disorders, eye problems, balance difficulties, reproductive problems, immune disorders, arthritis, cysts, osteogenesis imperfecta, and so much more. Like I said, connective tissue can be found in any organ system in the body, so everything is fair game when it comes to Ehlers Danlos Syndrome, and everyone is affected a little bit differently. Now, I do want to touch on how to get a proper diagnosis. Self-diagnosis and internet research are two really great things, and I encourage you to continue to do research and to learn more about your body, but I also highly stress that you see a qualified physician for a diagnosis, not just for insurance reasons or disability reasons, but because there are other connective tissue disorders and there are other conditions that can look a lot like Ehlers Danlos Syndrome that have a lot of overlapping symptoms and could potentially be very harmful for your health if ignored. I really recommend that you try to see a rheumatologist or a geneticist, preferably a geneticist that specializes in connective tissue disorders or sees patients with connective tissue disorders. And I know that that is not feasible for everybody. Maybe you don't live in a place where there is a specialist, or your insurance doesn't cover it, or in some cases maybe your parents aren't willing to take you to see the doctor. But I cannot stress enough how important it is to see a qualified physician and try to go after a real diagnosis. And now finally, what can be done about Ehlers Danlos Syndrome? As I mentioned earlier, that we do not currently have a cure for Ehlers Danlos Syndrome, and there really isn't one specific treatment recommended for EDS patients. So treatment usually involves treating whichever symptoms or related conditions are most impacting the individual patient. So it really varies from patient to patient. But one thing that I have to say is really important for any Ehlers Danlos patient is physical therapy. Because the ligaments around our joints are so weak and loose, the muscles have to really step in and hold the joint together. You really want to find a physical therapist who is willing to work with your individual needs and is willing to learn about Ehlers Danlos Syndrome, because you do want to avoid doing any more damage to the delicate tissues. You really want to avoid anything that is going to cause any kind of excessive stretching or putting too much weight on other joints. So you might want to avoid yoga, I'm sorry. Bracing is another thing that can be a very individual decision. Bracing and mobility devices, walkers, canes, crutches, wheelchairs. Some people will need braces or mobility devices every single day. They can't function without them. They're a necessity. And then some people will maybe have a brace or two that they put on their bad days just to get through the day, or if they have, a dislocation that day. Some people use narcotic pain medications and some people don't. It is kind of a personal choice, but for some people it really isn't a choice when the pain is just so severe that they need it to function. Some people tend more towards Eastern medication, so acupuncture, essential oils, meditation, stuff like that. I've had great luck with meditation. I know some people who have had good luck with medical cannabis. I personally don't really know about that one. I've had great success with using a TENS unit for pain relief. So, you know, everyone is kind of different. At the end of the day, it's just what works for you, because it's your body. You only have one of them. You're gonna have it your whole life, and you gotta make the best of it. I know it's really hard some days when you can't keep up with everybody else, or you feel like you can't get out of bed, but I promise you that you are not alone. You are not the only one going through this, and you're gonna make it. Alright everybody, thank you for watching this video. If you liked it, give it a thumbs up. If you want to see more videos like this, or you have questions for a question and answer video, please put it in the comments down below. I would love to read it, and I would love to hear from you. Please bear with me. This is my first time ever using this camera, and I'm only 4 weeks out of spinal surgery, and I'm just so tired of sitting and talking. So, thank you so much for watching, and I hope this was helpful to some of you. Hopefully this turns into a video. I got a lot of footage, but I don't know.